There have been several major developments in the treatment of myeloma in recent years. Arguably one of the most impactful has been the development of monoclonal antibodies for this disease, targeting CD38 and SLAMF7 and other types of antibodies coming up in the near future through preclinical studies and early clinical studies. Clearly, the development of daratumumab as a monoclonal antibody against CD38 has been a major development, and we can see that not only through the FDA approval of daratumumab in the last few years and several FDA-approved combinations of daratumumab, but also the fact that in this meeting many investigational agents are combined with daratumumab in order to examine to what extent they can improve the activity of daratumumab. So this has been a major development. And also we're seeing in this conference, and we've seen the last few years, the emergence of chimeric antigen receptor T cells as a new approach, and very exciting data about bispecific antibodies, for instance, against BCMA. From the bench to bedside translation, I would say it was quite interesting to see studies about development of additional methodologies that build on the chimeric antigen receptor T cell concept, such as CAR T cell constructs that target other antigens beyond BCMA, other forms of bispecific antibodies, chimeric antigen receptor NK cells. These are all preclinical developments but are expected to lead to additional studies that are expected to translate into the clinical setting. So I would say this has been a very exciting last few years. We've seen in this meeting the impact and growing impact of the development of monoclonal antibodies, CAR T cells, and specifically the bispecific antibodies more recently. And there's a lot of new additional modalities that are coming up, but this has been some of the major progress that we have observed in this meeting and in recent years. An obvious question that remains to be answered is how to treat patients who do not derive benefit anymore from combinations that are based on daratumumab. Every time a new agent becomes available for the treatment of a disease like myeloma, many patients at some point, and in myeloma still patients eventually relapse, even those that respond very well to all of these novel agents and combinations. So in the case of daratumumab, with the development of such a potent new therapeutic, it's still an unanswered question how to best treat the individual patient who has relapsed or is refractory to daratumumab-based therapy. So I would say this is an important challenge, an important unmet need, and a challenge in general is with all of these new classes of agents and all the different ways of combining them, what's the most appropriate way to deliver them to the individual patient. And that is an area of extensive research, both at the clinical and preclinical level, for which additional information is expected to be derived through the use of novel molecular techniques. And a lot of work was described in this meeting about use of next generation sequencing, including single cell RNA sequencing. And laboratories like mine are working extensively to use CRISPR-based technologies using cell lines in order to understand the roadmap, in order to understand the playbook that tumor cells utilize in order to become resistant to various therapies. And we hope that this research is going to provide a better way to construct and test hypotheses on how to individualize the therapy of myeloma patients that have many different options. In terms of novel developments in our area in myeloma, I'm very excited at the potential of using CRISPR-based functional genomic technologies to understand what are the most important genes for myeloma cells, what are the genes that allow them to survive, the genes that allow them to resist different therapies. This is an area that my laboratory has been very interested, and we're very excited at the data that we have observed so far, including data that we presented in this meeting. We're also very intrigued by the development of new forms of engineered immune effector cells, chimeric antigen receptor T cells. There were presentations in this meeting about chimeric antigen NK cell populations. There's new concepts about using different forms of CAR T cells with off switches and other tools that would make them easier to use and improve on their activities and properties. And bispecific antibodies also have been very exciting for multiple myeloma. And I think this is a very exciting time for the field, and we will see in the next few years, I believe, a lot more activity in these areas and perhaps some additional concepts on how to combine immunological approaches such as the ones that I mentioned, plus pharmacological agents that target some of the new dependencies that we're identifying through the use of CRISPR technologies. It's such a large number of very interesting presentations. It's a very exciting meeting with a lot of cutting-edge research. So it will be very hard to identify one or two of them and say that this is the only thing that one can mention. I would say I was particularly intrigued by the uses of the way that now there's a lot more experience in using recently developed tools for next generation sequencing in order to derive information not only about the tumor cells, but also the non-malignant cells of the microenvironment. And that has become especially important now that we have several immune-based approaches for the treatment of myeloma, both at the FDA-approved level and at advanced stages of clinical investigation. I would also mention, and again, this isn't the only presentation that I think is going to be very interesting, but from the preclinical side of things, I would particularly like to emphasize that there have been several presentations on the potential uses of MCL1 inhibitors for this disease. There's a growing interest in the targeting of MCL1, and actually my own group presented some data on the functional genomics impact of MCL1 in this disease, using functional genomics tools to characterize how MCL1 can interact with other genes and modulate their function, or the dependency of tumor cells for MCL1 can influence the response to inhibition of other targets. And finally, very interesting preclinical presentation that is being presented today at the ASH meeting is from the group of Jonathan Licht, University of Florida, on the development of a new mouse model of multiple myeloma that's based on the LGP130 mouse model that has a superimposition of the loss of function of KDM6A, leading to profound acceleration of the disease. And that's a very important development in the sense that it provides a new tool, a new system for the field to rapidly assess what is the potential role of different genes or different pathways in the pathogenesis of this disease, and the potential therapeutic implications of those pathways and targets.